Hi guys, and welcome back to my channel. Today I've decided to do a bit of an outdoor vlog because I'm outside and I wanted to talk about something that's really important to me. I will be looking in that direction simply because my laptop's there with all my little notes and stuff ready for me to give you the info that I need to. So today's video is on postpartum care, and before I dive into that, I wanted to just on lactation teas and whether they're effective or not. I just wanted to clear up a couple of things for people because I've had a few questions. Basically, the evidence has shown that there's not enough evidence to show whether that lactation teas are effective or not medically. However, on the other hand, lactation teas contain a lot of ingredients which is beneficial for the body and can help with milk production, or increase in your milk supply. So for example, the fenugreek seeds, these are naturally healthy things that will help to enhance your milk production and optimize your body's function, or your bodily function, full stop. So these things are naturally healthy that you should be taking in anyway. And again, once you are healthy and having all the nutrients that you need, it then also effectively allows for your production of milk to be optimized. So just wanted to clarify that for those who are a little bit confused as to whether lactation tea works. Let's just say it has an indirect impact on your milk. Breastfeeding is very hormonal. It is a supply and demand process. There's certain hormones that are released that allows you to breastfeed, or allows the production of milk to take place in order to supply your baby with the milk that they need. So this video again today is just about postpartum care and the importance of it for all you yummy mummies out there who are literally going through it. I'm with you. It is not the easiest, and I just wanted to highlight a couple of things that you can do and give you a few hints and tips on what I do or what you can do to help the process, essentially, because it is a lifelong journey. When you have a baby, it's continuous from the day you're pregnant, so on and so forth, till forevermore, essentially. So I just wanted to highlight the first 6 weeks of recovery post having a baby is the most important point in time. It is where your body's experiencing significant changes both internally and externally, and it will take a while for things to go back together. I won't say go back to normal, because I'm not here to tell you that things are going to return to how they were before, because then I'd be lying. You go through a whole change psychologically, physically, emotionally, spiritually, and it means that you are taken on a journey and you have to ride that ride. It's not going to be easy. You'll have moments of ups and downs, but it's all worth it on the basis of that little bundle of joy that you have within your possession. So as I said before, I'm not here to tell you that things are going to go back to how they were before, or that things are going to get better. Better is very, very I don't know, I wouldn't say it's something that it's very individual. So some people enjoy certain phases of their pregnancy, some people don't, and it's the same with the postpartum aspect of things. There's certain parts that will feel a lot easier than others, and it just varies from person to person, and it is very individualized, and will recover now at different speeds, time frame, rates, you name it. So it's very important for you to understand that you shouldn't compare yourself to anyone else or allow yourself to be compared to anyone else. Let's think about our mindset, okay? and that includes, you know, being compared to family members or, you know, friends, etc. Everyone's journey is different, and everyone has to travel their own journey on their own, essentially. So it's not fair for you to allow yourself to be compared to others, or for you to even compare yourself to other people, because we're all individuals. Your body will find its own way to heal, and as long as you give it the proper care it needs daily, then, you know, you should be absolutely fine. And as I said before, the first 6 weeks are the crucial periods, and beyond this you need to also maintain your postpartum care and your self-care for your, you know, for you. Because like I said before in a couple of my other videos, happy mummy, happy baby, and mummy always knows best. Okay, now I wanted to touch on the fact that a large amount of postpartum symptoms will settle within your first 2 weeks, but again, try not to worry too much if it hasn't completely disappeared. But if you are concerned, speak to your midwife, your health visitor, or your GP, or your health professional. This could be like a nurse practitioner. They are allocated a little bit more time to have conversations with people just in general than your GP. Your GP is allocated, you know, a 10-minute slot. Your nurse practitioner is allocated, you know, 20 to 30 minutes, so they have that little bit of extra time. Also, it's not uncommon that you'll still experience like backaches, perineal pain. This is the tissue in between your rectum and your genital area, as well as some soreness to your nipples and swelling to your breasts. You will experience pain in your lower abdomen as your uterus reduces in size. So this feels like contractions essentially, which are, you know, we are all too familiar with. And I just wanted to point out that with these contractions, the pain can be more obvious when it's your first baby, and it somehow amplifies when after multiple pregnancies, so, you know, your second, third, fourth, and so on and so forth. Essentially, the pain feels like you're literally in labor all over again. And can last for longer periods of time. So just if you are on your journey and you're pregnant currently and are waiting to have your little bundle of joy, or your multiple bundles of joy, then that's something to take note of, that you will experience, and you know, take your pain relief to help with that process, or, you know, whatever remedies you use, whether it's a TENS machine, just to kind of help you through that process, because it can be quite unsettling. And when you're trying to breastfeed your baby and you're having these contractions, which obviously breastfeeding triggers those contractions as your uterus shrinks, and it means that, like, you feel very unsettled, and with pain it means that you're now anxious and you're not settled enough, and essentially that can have an impact on your letdown, the time you breastfeed for, and just have you generally feeling meh, basically. So yes, that's something I wanted to also touch on. And again, it depends on your pain threshold. It varies from person to person, so this isn't, you know, a one rule or one shoe fits all situation. It can vary. Now I wanted to touch on tips for self-care. So I like to highlight that without self-care there is no care. So by that I mean, if you're not well and you're not looking after you, then there's no way you can look after everybody else within your household, or even your baby, to the I don't know how else to say it, but you can't look after everybody else the way you want to. Yeah, as to how they want to run their household, how they want to manage certain situations, and how they want to, you know, deal with their growing baby. And it makes you feel quite crap. Yes, so On to tip number 2. Aim to shower and bath, or shower or bath, sorry, I should say, daily. Fit a little time in for yourself and for your personal care to feel clean and fresh. It makes all the difference. And let's just be honest, you don't want to be smelling like the 3 S's. So let me tell you what the 3 S's are. Okay, sick, sweat and shit. Okay, you don't want to be smelling like that. No one wants to smell like that. And I know, like, a lot of people are thinking, what? Okay, but I can honestly say, I know the feeling of I just want to wash my ass. Like, that's all I want for the whole day. That is all I want. And you are so preoccupied looking after your baby, make sure your baby's fed, changed, clean, sleeping, awake, breathing. You don't, it doesn't resonate with you that you are also important. And any mum who actually is a proper mother, I'm gonna just say that, okay, that looks after their baby 24/7. And this is not a dig at anyone who doesn't look after their baby 24/7. If you have, you know, family members that help out and you have, you know, support networks, that's fantastic. But for those moms who don't, and this is who I'm here to advocate for, it is hard to put yourself first. It is hard to think, oh, I'm gonna go and wash. And wash where? Every time you go to do something, like, your baby needs you. Or you're so caught up in looking after them, you forget about yourself. And that's absolutely normal. And there is no judgment from me here. I literally sometimes go hours, like literally from morning to evening. I have to wait until when my partner gets home from work, where I'm like, okay, have the kids, so I can just have a shower, a quick 10-minute shower, and it's as if it's impossible. So I genuinely sympathize and understand where moms are coming from when they struggle with things like that. Point number 3 is find something to ground yourself. Even if it's 5 minutes a day that you set aside, set yourself a reminder just to do something like deep breathing, writing, listening to music, praying. Sorry, my children are obviously here. Do you mind? I'm kind of vlogging at the minute.
What are you vlogging?
Information. Thank you. Can I finish doing my vlog? Thank you. Okay, not right now. So where was I? Yes. So find something to ground yourself. Listening to music, praying, meditation, whatever works for you, because it is a long journey and you need to find a tool, something to help you when things get overwhelming. Okay, and trust me, they do. You're not gonna have every day is gonna be perfect and, you know, you manage to get all the things done that you need done. No, there'll be days when you genuinely just need to ground yourself. Okay, and then tip number 4, I would like to say, try and eat at least 1 meal at the table. Now, I know everybody's like, whoa, steady on love, that ain't gonna happen. But in reality, you have to try. It's just something that makes you feel a little bit more normal, and it helps. Okay, learn the art of delegation. Even if your partner works all day, you have been working all day and you will continue to work 24/7. Your work doesn't stop. So this is not something to be taken lightly. If you're breastfeeding, this is the equivalent of running a marathon. Like, I feel like it's very, a lot of people kind of use it in a blasé manner, as if breastfeeding is something that's easy. It is not easy. It is hard work. It takes dedication, consistency. It takes energy, time, just emotions, it takes a lot out of you, and it's not something to be taken lightly at all. Breastfeeding is hard work, and I honestly can only just say that and leave it as that. I don't need to go into too many details as to why it's hard work. It's just hard work. You're working from the moment you're pregnant to the moment, you know, until they're adults, and even then you're still working. A bit of sunlight in my face here. I like a bit of sun. Okay, also, tip number 5, treat yourself to something that makes you smile. Okay, honey, treat yourself to something that makes you smile, something that makes you happy, whether that's a chocolate, whether that's, you know, a fizzy drink, it could be a chewing gum, I don't care. Get that for yourself, because that's important. Give yourself something that makes you smile. And I know it sounds so silly, but it's literally like the smallest things that makes the difference. So try and do that. Do something that makes you happy. Tip number 6 is, I don't think I can say this on here, but I want to say F the housework. Now, I use this lightly. Obviously, maintain your house as best as you can. Do maintenance cleans or whatever. 15-minute cleans, love those, because it just gets everything just tidy, and then you can save your deep cleaning for another day. But essentially, listen to your body. That's what I'm trying to highlight here. When your body needs rest, sleep. Yeah, sleep when your baby is sleeping. And I know that's hard, because a lot of the times we sit up watching them, making sure that they're still breathing, just because of all of the information that we've given about cot death and things like that. It does emotionally kind of grate on us, so then we don't sleep because we're watching our babies all the time. But try and sleep. Rest is so important. You will burn yourself out. Housework will be there when you get back. It doesn't go anywhere. And, you know, if finances does allow it, get yourself a cleaner once a week to do like the deep clean, and then do maintenance cleans throughout the week every day. And if not, and you have a partner, you guys sit down and make a list together, tasks and chores and things like that. Your job is 24/7, and when they get home from work, they've just started another shift, babe. And that's how you got to look at it. You can't see it as, oh, they've been at work all day, therefore, you know, I can't ask them to do anything. Absolutely not. There's got to be balance in your household, balance within your relationship, and it's got to be fair. And when you've been at home with the baby all day, in reality, you barely get anything done. It's just the truth. You're so busy and tired and exhausted. It's not going to happen. You need support. So, you know, let's be real about this. Now, I wanted to touch on just the last few things before I close. Little tips that I wanted to give in regards to, you know, wombs, birth, etc., etc. So depending on the kind of birth that you've had, if you have had a vaginal birth, try and maintain your daily hygiene in your personal areas, and ensure that you change like your pads frequently. Do not use tampons after you've had a baby, just because of the risk of infection, and your body is still recovering, so give it that time. Do you understand? You may struggle with opening your bowels post-delivery, and normally a midwife or a health professional will check with you that you have actually passed urine and opened your bowels before you leave the hospital, or before, you know, they sign you off, essentially, whether you've had a home birth or not. And if you haven't opened your bowels, that's fine, but you definitely need to pass urine before they can actually discharge you, whether that's from their care in the community or from in the hospital. And they'll let you go home even if you haven't opened your bowels. But if you are struggling, try and eat like fibrous foods, have plenty of water, not only just to hydrate yourself, but it also helps with increasing your milk supply. and you do need enough fluid if you are having a fibre-rich diet, okay, because that helps the movement of that fibre, or else it's kind of just stuck there in your bowels or in your intestines. Okay, so also if you've had stitches due to tears or anything like that, they would normally do dissolvable stitches for you, so those should be absolutely fine. Just keep an eye on it, you know, in terms of, when I say keep an eye on it, I use the term loosely. So essentially just look out for any odours, any discharges that are not of normal colour, just because of risk of infection. So you keep an eye on that general area, and obviously maintain your personal hygiene in that area, and you should be absolutely fine. If it's just grazies, those naturally will heal on their own, and you don't need to do anything for those, okay? And your midwife would normally check those to make sure that everything's okay there, and you should have a check with your GP. You know, your 6 to 8 week check that you would do, you'd have for your baby, you also have one for yourself as well. You can use warm and cold compressions, such as a warm flannel for swelling or for swollen or achy breasts. Take a warm shower, and this should help to relieve any sort of aches and pains in your breast area, and it also allows for some milk to leak out, and that prevents you from getting mastitis, okay, or it should help essentially. Now practice your pelvic floor exercises. This will help everything to go back to shape and help to prevent or fix postpartum urinary incontinence. A lot of mums will tell you, and I chuckle because, you know, a lot of mums will tell you that they will experience things such as coughing, sneezing, and they leak a little bit of urine. And it's important to talk about those things, because your bladder and your sphincter is not what it was before, okay? So that's why we have your pelvic floor exercises, to help to strengthen that muscle, because it does tend to weaken during pregnancy and post-delivery. Also, if you have had a C-section, this means you have got an open wound that needs caring for. So try and wash and dry the area daily with clean towels, clean flannels each time, and remember to try and keep things as aseptic as possible. So what I mean is, try not to infect it with your hands. So make sure you wash your hands first, and that you're drying it on a clean towel or kitchen towel, whatever it is that you're using, to basically hand hygiene. Just keep your hands clean, and then that general area, don't use anything from anywhere else. Make sure that you use clean dressings if you need to put back on dressings, and you've been shown how to do that, and clean gauzes to clean that area. Now just ensure that you check with your health professional how to maintain your wound and how to look after it, and if you need any follow-ups and checkups, which I'm pretty sure you would do, so they'll keep an eye on that for you. Walk around, okay? Walking around helps to reduce the risk of blood clots, and there are far too many women who have postpartum blood clots, just from their general pregnancy, where they've been sitting down for long periods of time or unable to move due to, you know, SPD or anything like that, or just general aches and pains, and just carrying that weight load of your baby means that sometimes you're not as active as you would have been before, and that do walking around to help to prevent that, as well as for your mental health. You don't have to get back straight in the gym, babe. It's not that kind of party. It's not necessary. If you want to, by all means, I wouldn't recommend it, but some people, that's what they use as their therapy for their mental health and to keep them stable, and I understand that. but try not to overdo it, and just make sure that you listen to your body first, so you know when it's too much. Make sure you stop. And last but not least, I want to say eat well. Try and have a balanced diet. It helps with fatigue and burnout. And just remember, your body will use whatever nutrients you are consuming and give it to your baby. So have your vitamins and your supplements if needed. Do check with your health professional that it's okay to take certain vitamins and certain supplements, and that it's safe to consume whilst breastfeeding. And this includes herbal medications as well, because a lot of people don't class herbal medications as medicine, and because they think it's natural, therefore it's okay to have it. No, check with your health professional first, because if you are then providing your body with too much of something, then that can have a knock-on effect. So always double check. It's like eating, you know, a ridiculous amount of bananas. It's a natural fruit, and you'd think that's absolutely fine. However, it carries potassium in it, and potassium is, you know, is something that your body needs, but too much of it can cause issues with your heart. So it's about moderation, and checking with your health professional first that it's okay for you to do those things. Ensure you're having a combination of complex carbohydrates and proteins, as well as your fruits and vegetables. And if you are struggling to eat a whole meal, try and eat little and often. Eat when you're feeding your baby. That way you remember and you remind yourself to eat. I found that to be my go-to method, because I always forget to eat. I always forget to drink. So what I do is, whenever I know that it's my baby's due for a feed, or I can feel that it's coming up to that time my baby needs a feed, I grab myself something at the same time. It doesn't matter what it is. It could be a sandwich, it could be a fruit, and I try and have that and have something to drink at the same time. And that tends to help me to remember. Hydration, hydration, hydration. Drink your 8 glasses of water a day. Try your best. We are, you know, we need to drink as humans, but also as breastfeeding humans. And when you're breastfeeding your baby, you need to drink enough. You need to ensure that they're getting, you know, their water supply comes from you. If your baby's only breastfed, your baby gets their water from your breast milk. Okay, I know that some people will bottle feed, and then they do have to give their baby a little bit of water. Just be careful with that, and not overload their system, because babies aren't actually supposed to be drinking a large amount of water. So check with your health professional and just see what it is that you can and can't do, just to be sure, because obviously every baby's different, so you have to tailor what information I'm giving to you in accordance to your baby and yourself. Okay, and enjoy every day as it comes. The time goes by so quickly, and you don't get to relive these moments. Enjoy your baby and give your baby the best you that you can give them, and that means catering for yourself first. Your baby doesn't need any leftovers of you, they need you. Okay, and I just want to shout out to all the mums out there who is doing their thing, who's looking after their baby, holding down their job, and, you know, maintaining a household and all that and in between. It's not easy, and you are an empress for being able to manage all of those things. Just stay tuned, keep your head high, and you'll be absolutely fine. So until my next video, take care, and thank you for watching. Don't forget to subscribe to my channel if you like my content, and stay tuned, because we do have an Ask the Nurse segment that's coming through as part of the Breastfeeding ASMR, and it will run alongside Breastfeeding ASMR, just to answer and debunk and get rid of all the jargons behind certain conditions, and just explain to you guys in the greater detail, and in plain English, and simplifying what it is about these conditions and what you need to look out for, the signs, the symptoms, and also the treatments, depending on what people request. So stay tuned for that. Till next time, bye bye.